Hi there, Dr. Carmen McGuinness here. Have you ever wondered why some people do pretty well when they face crises in life and others are often ruined, or at least for quite some time? Well, that is actually called psychological resilience. And today, that's what we're going to talk about right here on my channel. Hi there, Dr. Carmen McGuinness here. On this channel, we discuss relationships of all sorts, including what I call the primary relationship, which is the relationship that we have with ourselves. Today, we're going to discuss psychological resilience. It is one of the greatest skills that any human being can have, because with it, we can get through life's difficulties with more ease and more comfort, and snap back to where we were before the crisis occurred. And that's actually part of the definition. I'm just going to read you a definition that I've sort of worked together to put into terms that I think will be helpful for my viewers. Psychological resilience is the ability to mentally and emotionally cope with a crisis, to recover equilibrium, which is a sense of baseline, and return to the pre-crisis status after the event. Resilience exists when we behave during and after the event in ways that maintain baseline and protect ourselves from the potential negative effects of the event. Behavior includes both physical and mental responses. So it's not only what we do, it's what we think as well. So now we'll go through some factors that contribute to psychological resilience. The first one I want to share with you today is future thinking. Even during the difficulty, if you can focus on the future and being beyond the difficulty, how much better you're going to feel. It can help you get through some difficult times. Example of that is medical procedures. I've had a lot of clients that I've worked with have had to have quite difficult medical procedures done. And I always encourage them to go into the procedure thinking about how great they're going to feel when it's over, when it's done. I'm remembering dental procedures that I had done where I had that exact thought. Just keep thinking about what's going to happen when it's over with. And it's also, it's a good idea to plan something. If it's a crisis that you know is happening, it's a good idea to plan to do something happy afterwards, something that's going to be reinforcing for you. Reward yourself. So staying focused on the future during and after a crisis is a very important piece so that you can snap back to where you were before the crisis happened. Another factor that contributes to psychological resilience is self-love. Understanding that when crises happen, they're not about you. Bad things do happen to good people. That's one of the most important and most difficult lessons to learn, is that bad things happen to good people. Understand that it's not your fault that this crisis occurred, versus why did this happen to me? An example of this in my own life is when I broke my arm last summer. Still have a cool scar here. And those of you that have been subscribers since then remember when this happened. I missed only 1 week on YouTube. But when it happened, my first thoughts were, stupid me, stupid me, stupid me. That's what went through my mind. Why did you step backwards onto that? You fell. Why did you put your arm out? You would have been fine if you hadn't put your arm out. Stupid me, stupid me, stupid me. It was only after I got to the doctor, found out what was going to happen next, surgery, etc., that I was able to slip into a healthier mental state, which is I fell and tried to protect myself. That was actually a smart thing to do. I have great reflexes. That's what the doctor said to me. Wow, you must have great reflexes to get that arm out so fast and so far that you were able to break it. So love yourself. If there's something that you did that helped cause the crisis for some reason, there's so many different circumstances in life, automobile accidents, things like this, then forgive yourself. It's very important that you love yourself. It is a factor that contributes to psychological resilience. So the first two are future thinking and self-love. The third factor that I want to share with you today is positive thinking. An example of this would be, what is the lesson in this experience? And I want to frame that very carefully. I want you to think of it as, what can I learn, rather than what lesson is being forced on me, like the universe is giving you a lesson or something. I want you to think of it as you have an opportunity to learn a lesson from this crisis, and what might it be? And it might be multiple lessons. It's a subtle but important difference that it's an opportunity rather than a lesson that is being forced on you. And with me, with the broken arm example that I'm going with today, I just really kind of felt like, well, I guess I'm meant to lay around for a while, stop working, just take a break. And I did. It was it was a good 4 or 5 weeks before I was able to get back to my regular life. And I did some self-analysis during that time when I was unable to write, unable to really do much of anything. So keep it in perspective also when you're having positive thinking. If you go into too negative of a perspective with whatever crisis you're facing, then you can end up getting in such a deep hole that you just can't be positive about it. So keep it in perspective. And as I say these things, please understand, I realize that very difficult things happen to people, but we have to maintain the perspective of the rest of our lives. So, moving on to the next one, psychological flexibility. And this is the capacity to manage strong feelings without being overwhelmed. In life, we have highs and lows. Those who are uncomfortable with the highs like joy or the lows like deep sadness and prefer to maintain a calm middle ground all of the time, well, they're going to struggle with managing crisis, and they're going to miss many of life's peak experiences along the path. So I would encourage practicing psychological flexibility. And this may be another talk entirely. We may need to spend a few minutes on psychological flexibility on another day, maybe next week. But for today, let me give you one example of how I work out my own psychological flexibility. I do yoga. I practice yoga. Yes, physical and psychological flexibility are very much related. And I train mine together. I do a psychological flexibility workout every day when I practice yoga. Even if you don't practice yoga, you can stretch. You can just get on the floor and roll around. And as you do, allow your mind to stretch with your body. Envision faraway places. Envision your childhood, which is probably a faraway time. Imagine your old age. Imagine what it would be like to stretch when you're older. Remember what it was like to stretch when you were young. Think of different things that are extremes, hot and cold, high and low. What would it be like to be doing this stretch up in a tree? And this is in your mind, of course, but it builds psychological flexibility. So the next factor that contributes to psychological resilience is the idea of what will I take forward from this? And this is bigger than the lesson that we talked about earlier. Some people just wish to forget their crisis. They don't want to ever think about it again, and they try and bury it. And that's an avoidance coping tactic that is not necessarily a good idea. Others take forward a narrative. Being in control of the narrative is an important asset of people with psychological resilience. A better therapeutic understanding of physical limitations and responses to incapacitation is what I took with me after I had a broken arm. And it's important to have that for me because I'm a therapist and I work with people who have quite difficult physical impairments or go through, as I mentioned, physical medical procedures. So having that better therapeutic understanding of physical limitations is something that I took forward with me as a result of having to go through a broken arm. So what is a narrative exactly? Well, a narrative is a way of packaging an event or time in your life. It's a way of telling your story around what happened, about the event. How you write your narrative about your troubled times helps determine how you process the emotions around the event. Think of it as writing on your nervous system because really that's what you are doing. You're putting the event into your body in a way that you can be comfortable with when you write a narrative. And that's entirely different to an avoidance coping way of doing it when it pops up just anywhere in your body and you end up with chronic pain and things like that. And working with a narrative helps determine how you feel about the event in the future. So, and maybe we need to do another talk on narratives. I know I did one about a year ago, and I'll put a link up to that here. So we're just going to recap a little bit. So psychological resilience is the ability to recover after a crisis. And some of the factors that contribute to it are future thinking, self-love, and forgiveness if you're involved in the crisis in some way, if you somehow actually did cause it. Positive thinking, psychological flexibility, which is related to physical flexibility, asking yourself what you will take forward into the future, and writing a narrative, writing or at least having a narrative in your mind about what happened. So that's what I have for you today. I sincerely hope that this is helpful. I hope that your crises are minimal in life and maybe small ones rather than big ones. And I wish you the very best today and look forward to seeing you on Wednesday for my midweek sneak peek.